body so that you can be healthier, specifically your joints, your knees, your elbow. I don't know if we've ever talked about elbows, but
I don't think so.
Arthritis areas. Mark, help me out here because I'm never going to get it right. Good morning, Mark. How are you?
Good morning to you, Larry and Robin. Glad to be here.
There was a news item I wanted to ask you before you get started. It was in this morning's news. It says the age reversal work of a doctor in Philadelphia hopes to start human trials on brain-dead patients in Latin America. Now, that sounds kind of science fiction-ish, but I just want to tell you. I just want to tell you what it says. It says the biological extracts incorporate material from the person's own body, and that sounds like what you do.
It's exactly what we do, my friend. And that's what they're starting trials on, and medical science is moving forward every single day.
Wow.
But the growth and the boom in medical science and what has been taking place over the last several years is, to relate that, you remember, within 3 months of getting a brand new cell phone, they're already out with the newest one, right?
Yes.
Or the next new piece of technology, and the next medical science is now moving that quickly. It is making strides where I saw an article just the other day that a patient one of the first patient ever that was paralyzed from the neck down, has now regained the use of his upper body.
Oh my gosh!
From stem cells and the use of stem cells, and that is, the cells that you have in your own body.
Wow.
And so, yes, I'm sure the doctors are doing that. I haven't seen that particular article in regards to, the brain-damaged patients or brain-dead patients and utilizing it. But your body is, it's very fascinating, but it is very efficient at healing and taking care of itself. And when added a little bit of medical science and no synthetic drugs and things of that nature, we can take your own stem cells, your own body's regenerative properties,
right,
and heal. Heal knees, backs, elbows, and yes, elbows. We've had a patient, just probably a month ago that came in for tennis elbow, Larry, and we injected. This patient could not even hold a tennis racket. Now, tennis was a very, very important part of this woman's life.
Mm-hmm.
Could not even pick up a racket. Couldn't hold it in her hand, and is now back to being an avid tennis player and enjoying that part of her life.
See, and I'm guessing that's practically 100% of your clientele. I'm sure that you don't have too many brain dead people coming to see you. So
No, we would not. We're going to refer that one out.
But I guess my point is that if the technology that you're using to help us with our knees and our elbows is helping people who are paralyzed, then certainly we should be able to consider it. If there's no sense in living in pain if there's a way to fix it.
There is no sense in living in pain. This is the equivalent of you now. Most everybody has a smartphone and things of that nature. And you look back that it wasn't even that long ago we were at flip phones. And the flip phones were like, oh my God, this is miraculous. This is amazing. And now, nobody has that. We have iPhones. We have these type of things. And it's the same thing in medical science. We look at it and we go, okay, you have a knee problem. And you've been living with this knee problem for 5 years, 10 years, and some patients even longer. You don't have to be in pain. We can regenerate that knee. We can help you with your back. We can fix your shoulders, rotator cuff tears, ankles. We just dealt with a patient who had an ankle injury, and we're regenerating that ankle. That this person is an avid jogger and has lived with this pain for 5 years. So it's not we're not performing miracles or miraculous. We're just literally using technology and medical science that is not theory-based. It's evidential-based medicine at this point. It is the proof is there. There is nobody guessing anymore as to does this stuff actually work, and it's just a matter of are you willing to come in and have this? And it's your own body. There's no side effects. There's nothing.
And the people don't have to wait, because sometimes a person will start to lose their gripping ability in their hands. They'll pick up a cup and it'll fall to the floor. They'll pick up a pencil and they can't maneuver it anymore. So as soon as it happens, they need to come to you.
Well, that is, that arthritic and degenerative process can be reversed. at this point. I mean, we can start to unwind the clock. And you can simply, if you go to our website, Regenetiq.com, okay, you do a Google search, REGENETIQ.com. You will see patients on there from Bill Warfel, Bob Calendar. You're going to see other patients that we have on there that we've recorded. Even Joe. Joe is on there as well, letting you know, and patients saying, I was scheduled and told you're going to need a knee replacement. And that's why he came and saw us, and it scared him. Bob had been a kidney transplant and had been dealing with these types of pain for a long time because the medications he can't take, they won't take him for surgery because, obviously it's more important of staying alive. When he found out it was your own body that we utilize, he came and saw me. And you can hear his testimony on the website as well. Bill Warfel was literally stopped playing golf. He came to me and said, I have quit golf. Golf is an avid part of my life. I'm retired. I enjoy it. He plays every day. And had quit. He said, I can't do it anymore. I'm done. And his shoulder was in that much pain. You'll hear him say that on the testimonial himself. Don't take my word for it. Go to the website, look at it, listen to these people who are extreme cases, and they came and saw us, and now Bill is back to playing avid golf and enjoying his later years in his life.
I'm looking at it right now. Wow, I didn't realize you had these video testimonies. There's Joe. Look, sitting right here in the studio.
Nice.
Do you know what? I wanted to ask you this. I'm just guessing there are two ways that our knees, for example, might need to have some repair work done. One is because we have used them for years and years and years. The other one could
degenerative.
Okay,
right?
And what if we're young, let's say a high school football player
could has an injury?
Yeah. So could you help?
That's acute.
Okay.
Right. That's an acute. So there's two types. That's correct. There's acute and degenerative. Okay, and we put arthritic change in the degenerative process. That falls underneath that category, okay? Whereas an acute injury, for example, there are major acute injuries such as tearing an ACL. And we're using knees because we've been on, knees all morning, okay? But this is backs, elbows, rotator cuffs if you're a pitcher, all different types of things, okay? But there's an acute injury, all right? If you go out and you play a baseball game and you're throwing a 90-mile-an-hour fastball and you do it 100 times around a game and you're doing that every third day, okay, you're likely going to have small tears or things of that nature in your rotator cuff. All right, that is an acute injury. That absolutely 100% stem cell and PRP, we can get phenomenal results with that. And probably 99% of all major athletes utilize platelet-rich plasma and stem cell for that exact reason today, right now. It's happening every single day with every major athlete across the board in every major sport in the United States. The degenerative process is what we're using it for as well. So if you have a torn ACL, your option is surgery, obviously. If you have a ruptured, Achilles tendon, all of these types of major acute injuries, yes, you need to go see a surgeon and see a doctor. Now, when you see them after the surgery, they're still going to give you PRP because the healing factor is going to make your recovery time that much faster. If it is smaller tears, like tears in your meniscus, which is a small disc of cartilage that is in there as the knee as a shock absorber, if it's small tears in the rotator cuff, absolutely 100%. You did not have to go for knee replacement surgery or major knee surgeries or anything else. It's a very uninvasive procedure of PRP where we inject the knee, and within probably 4 weeks, 4 to 6 weeks, I would say, you're back to probably 85, 90, close to 100%.
Wow. Mark Shaw is our guest. He is the case manager for Dr. Juan Jordan down in the Villages. It's always important that I tell you when we talk to Mark that this is not a procedure you have to fly to Philadelphia for. It's right here in our listening area. So the Villages is where we want to send you, to Dr. Jordan's office. I just wanted to tell you this, Mark, that coincidentally, I went to your website and I did not know that you could use regenerative medicine to help people with COPD. And the reason I want you to talk about that a little bit is because the show just before yours, they were talking about COPD with the veterans. And is that, I mean, you can actually reverse whatever has gone wrong to cause COPD?
What has been taking place with COPD and what has been happening is there are offices, around the country, and they've been doing case studies on putting it into a ventilation system where you breathe it in, all right, and it prepares the lungs for stem cells to go in there, which actually, your entire body is made up of these cells from your lungs, your skin, your muscle fibers, your tendons, your cartilage, everything else, okay? And it is, in cases, yes, we have seen it reverse, but in most all of the cases that we have seen, it puts a stop to it.
Oh, okay? Wow.
Meaning it will not continue, because COPD it's going to continue until the day you die. I mean, it's going to continue to degenerate, okay? And it's going to continue to go down and get worse and worse and worse and worse, okay? And yes, it is actually, we do not have the protocols in immediately right now, meaning all it is getting the correct procedures and steps, meaning how to utilize the ventilation system and everything else for the patients. We have to get those here in the office. But yes, very soon and very shortly we are going to be utilizing that for all of Dr. Jordan's COPD patients, and to have that treatment in.
We invite you to call right now if you want to speak to Mark to ask him questions about what's available for you down at Dr. Juan Jordan's office. The show is called Regenetiq. We want to send you to the website, which is regenetiq.com. You need to know the spelling. It's REGENETIQ. Make sure you put a Q at the end of there. And under the therapies button there, it says regenerative medicine, stem cells, COPD, PRP, aesthetics. You might want to ask about that. Instead of getting a facelift, maybe do something more natural.
Exactly.
I'm guessing.
Yep.
And then weight loss. So
That's-
you have somebody named Kathy on here who's talking about the vitamin program you put her on. So
That's correct. And that's our medical weight loss program that we utilize. And you'll see patients on there who've lost 40, 50, 60 pounds. And, many of our patients that come to us have other degenerative and problems, meaning such as surgeries that they need to go have. And it's a dire situation for them because doctors won't take them because they're too heavy. And they've come to see us, and then they were able to go get the surgery that they need. And it's just simply because, we are not pushed by, any other type of weight loss program, meaning we don't have to sell it. We make sure that the patient fits into the right weight loss program, and it's done through medical science, and it's done by a doctor and not, someone who is there to move weight loss products.
And you have done the very smart weight loss program, because the weight is not dropped instantly. The person's lifestyle is adjusted so that way when they reach their goal weight, they don't have to do all of this maintenance with shots and pills and things like that. They're on a eating regimen that lasts for their lifetime.
That's 100% correct. And you have to look at it logically as a person who, from joining gym memberships to this weight loss to that, there's a million of them out there. But you have to look at it logically and go, okay, is this sustainable for the rest of my life? Am I going to eat this bar or drink this shake for 2 meals out of the day for the rest of my life? No, you are not going to do that. You are going to, at some point, now it might be a year, it might be 6 months, it might be 2 weeks, okay? But at some point, you're going to say, man, I am fed up with this. I cannot look at another bar or shake or this or another, starving myself with something. And you're going to break. And when you do, it's going to all come flooding back. And that's inevitably with all of these diet and weight loss programs. With ours, it's a 16-week program, and it's a healthy weight loss. The first 8 weeks of that program, we're having medical science actually tip the scales vastly in your favor. And the remaining 8 weeks, we're using that to actually make a lifestyle change over 16 weeks for you. And most people think, oh, well, I have to give up everything. Absolutely not. It's the opposite of that. I want you to go to the grocery store like a normal person, because that's what's sustainable. Go to the grocery store, buy food, eat real food. You can do that for the rest of your life with a huge variety of what you can eat. What you can't do is drink a shake or a bar for the rest of your life. You're going to get sick of it.
Right. Oh my gosh, let's take a phone call, and everybody's welcome to call. We do have one waiting on the line. The number is 622-9622. I'll take them as they come in, so just be patient with us. If it's ringing, you know you're going to be on. So that's kind of how I can put it. But nobody ever says hello. There is no call screener. It's just I see it, I hit it, and then I go to it. So let's go to somebody who's been waiting patiently, I hope. Good morning. Thank you for waiting. You're on the air with Mark Shaw.
Yes, thank you. If you have a son that's entering high school and is very, very much into sports, and you're worried about him in later life, would it be advisable to kind of encourage him not to go into football because it's a bad sport for knees and it's going to probably be a problem later in life, and maybe to encourage him going into bowling or golf or something that's not so strenuous on the body? Do you think that's a good thought?
Okay, so first I will let you know, I actually was a football player through high school and college, and so my particular preference would be no. I wouldn't encourage, my son or anyone to not go into football or any of those things. The second thing that I will tell you is that golfers later in life have received almost just about as many injuries as football, meaning it is an impact sport where you do a repetitious slamming a club into the ground. It is very, very hard on your back, okay? Meaning your back actually is one of the things that is hurt the most, and your knees in golf. The torque and the strain that it puts on these joints and these ligaments is very, very strenuous. So where I can say that, baseball, you're sliding and you're jamming knees and fingers, or golf, it's hurting your back, or football because of concussions or any of those types of things, I would let you know that, sports was a big part of my life. And what I did is, I try to take care of my body as much as I can. But there's really no sport out there that doesn't come without any injuries, okay? Every sport has its potential injuries for later in life, from basketball to tennis to football to golf to every sport that's out there. What I would utilize is, if he has had trauma or traumatic injuries already from any of the sports that they've been playing, understand that from those injuries there's going to be scar tissue there, okay? And the more proactive that you take it right now to utilize even PRP or, supplements, glucosamine and things like that to reduce that scar tissue, the better they're going to be on later in life. Because that's what eventually is going to cause that arthritic change, and it's going to come on faster.
Well, this news is going to be very happy for my grandson, who's very interested in going into the heavier sports, as I call them. So thank you very much.
Very good. Yeah.
You're welcome.
Yeah. Wow. I love the answer you just gave. I mean, that is that is something to be confident about then. Mm-hmm. Yeah.
And
I mean, that's you can say, okay, well, my son played golf. I mean, well, I can show you from Freddie Couples to, God knows, from Tiger Woods. I mean, you tell me golf is not a sport that doesn't have injuries. I mean, he's down with his back. Everybody's seen him in the news. Right. Both knees. Freddie Couples is the only reason he's playing golf today is from the stem cells and the PRP and everything that was done on his back. I mean, you can go back and look at his career, and he'd lay down in the middle of the fairway and start trying to do exercises to loosen up his back.
Oh my.
So, yeah, it's very, all of these sports. Rafael Nadal playing tennis was out for an entire year. Novak Djokovic playing tennis. He's out right now because of an elbow. All of these athletes in all sports, you're going to receive some type of injury. From track to basketball, all of these things, it's going to happen. When you do take a proactive stance and heal your body the best way possible, whether that's surgery with PRP and stem cell or just utilizing PRP and stem cell to come in and handle the scar tissue and take care of those things now so that you're not dealing with it when you're 75.
That's really good advice. It's something that you couldn't even have mentioned probably just 10 years ago because things have changed so much. We do have another phone call, Mark. Let's take that call. Thank you for waiting. Good morning. You're on the air with Mark Shaw.
Hey, Larry, Mark. Tiger Woods. It wasn't the golf that did his back end. It was his extracurricular activities.
I won't speak to that, but
that's funny.
And when you talk about high school sports, weightlifting comes to mind. My cousin's daughter, she's a senior in high school, and she's one of the champions for the state of Wisconsin on the high school level, and she's a woman. And sometimes, women's bodies are different than men's bodies, but she has to have some kind of regimen to keep herself from getting hurt also.
Absolutely. There's obviously caution in the sports that you play, meaning do it properly, have coaches, have people that are going to keep you from, there are steps that you can take to do things properly. From football, now we're seeing, from concussions, there's a proper way to tackle and don't lead with the head and all of those types of things. Weightlifting, any type of sport that you're dealing with, yes, there's going to be instruction to lessen the danger. But inevitably, when you're doing these violent motions, these, any type of strain and, tear on your body and your muscle fibers and everything else, there's going to be injury. There's inevitably going to be injury.
Mark, we have 1 minute left. I would like to ask you, before you give the phone number, how much does it cost for a first visit? How much is the...
If you come see us, it is absolutely 100% free. You come down here, you see us, and if for any reason that we can't help you, meaning you don't fall within the category of PRP or stem cell, at least we're not going to waste your time either. We're going to refer you to the correct doctor. And we've actually done that with participating doctors in the area. We refer out and say, listen, this is the person you need to go see for this. And then after you get this done and handled, then we can help you. And we put you on the right track, and it's absolutely free. It doesn't cost you a thing to come in for your first visit.
That's awesome. I would recommend you go to Regenetiq.com. Just, if nothing else, listen to Joe Martone's testimony. You all know Joe. And by the fact that there's Joe on there, it gives you reason to trust what Mark is telling you. Joe's given his testimonial. He's had the treatment for his knees. And what's the phone number, Mark?
You can reach us at 352-633-0473. The young lady at the front is Elizabeth, and just say I'd like a consultation in regards to my knee or my back with Regenetiq, Mark Shaw, Dr. Jordan, or whomever, and she will get you into our schedule ASAP.
Good stuff. That's really good. And can I throw in hair loss, by the way? If you they treat hair loss, PRP for hair loss.
Yes, we do. It is in there as well, and there are specific cases, and of course your assessment on that is free as well. Come in and see us, and we'll let you know if it'll work for you.
Wow, good stuff. Thank you, Mark. Thank you for being on with us today.
Thank you both for having me.
All right, we will be right back.